As a child, I suffered from video game addiction, which saw me spend over 6 hours daily on the screen. My parents went out of their way to help break me out of this addiction. Some of the activities included the introduction of outdoor sports, as well as spending more time with them. The creativity and handling of the issue is what inspires me today. Alcoholism is an addiction that affects the normal functioning of the body and requires creative remedies to overcome it. I've done the research and found many credible sources that point to the use of MDMA for recovering alcoholics. First, I will inform you of MDMA, its psychotherapy uses, and will finally conclude with the impact that its controlled use has on recovering alcoholics. First off, MDMA is a ring-substituted amphetamine with structural similarities to mescaline. As defined by Thal and Merriman in their 2018 article, it is crucial to focus on its history and its evolution to usage in psychotherapy. MDMA was first synthesized in 1912 and consequently patented in 1914 by the German pharmaceutical company Merck KGaA, while identifying blood clotting agents. After numerous tests, it did not work as desired and was therefore set aside. Research on the substance was studied in 1978 to reveal the positive cognitive effects that MDMA could have. In a controlled clinical setting, the positive cognitive effects of the substance included enhanced mood and well-being, extroversion and social ability, happiness, and relaxation. The desire to achieve the effects led to the abuse of the drug in the market. The Drug Enforcement Agency consequently categorized it as a Schedule I drug. MDMA is most commonly known by its street names, Molly and Ecstasy. With that critical understanding of the history of MDMA and its evolution to use as a recreational drug, I will now inform you of the use of the drug for psychotherapy use, especially in PTSD. The Scientific American article on MDMA's journey from Molly to medicine by Alfonso Serrano highlights the successful use of the drug in the treatment of PTSD by war veterans. Its use in psychotherapy is due to the impact of different parts of the brain that affect hormonal discharges. MDMA limits the amygdala, which is the fight or flight response part of the brain. In essence, controlled use of the drug reduces fear as individuals confront their traumatic memories. This makes them speak more to the therapist without feeling danger and is consequently instrumental in the final prescription given. The 2013 article by Jerome Schuster and Yazar highlights that the use of MDMA increases the empathy levels of the user, consequently allowing them to interact better in society. They will seek for ways not to harm both themselves and others. This is highly beneficial as they try to reacquaint themselves with the normal functioning of society, especially after having PTSD. Alfonso Serrano highlights the process used by psychotherapists as they handle patients and MDMA. The patients decide the course of treatment and the specific dosage that they require based on the interactions with the therapist. Controlled exposures reduces the probability of abuse and is instrumental in the success process. Now that we've gone through MDMA, its evidence-backed use in PTSD psychotherapy, I will tell you the uses of the drug in reversing alcohol abuse amongst users. A 2019 article in The Guardian by Helena Blackstone revealed that the use of MDMA in alcoholism treatment significantly reduced relapse. Basing on the article, I will show you the success in the treatment offered and how MDMA impacts users. 8 in 10 alcoholics relapse in England under standard treatment approaches. The success of any alcoholism treatment is based on the relapse that ensues. The controlled use of MDMA resulted in the promising results taken after 9 months of the treatment to measure the relapse levels of the individuals. The use of the MDMA for alcoholism treatment revolves around clinical sessions undertaken weekly to gauge progress and allow for impact. According to Sam Blackard, a reporter at the Daily Mail, the typical session involves a consultant psychiatrist and a clinical psychologist. After the administration of the drugs, there is observation of the patient's behavior. Over 24 hours, they see how they specifically react to the drug. Psychotherapy deals with addressing the trauma that is facing the individuals, and it is using this undertaking that it allows for the use of the drug. Addiction mostly stems from underlying trauma, and the use of trauma-focused psychotherapy breaks these. MDMA suppresses fear and allows us for the speaking on traumatic issues, thus allowing for success in the interactions between the various parties. So far, we've gone over the synthesis of MDMA as well as development for the use in clinical and psychological settings. We then went through the use of the drug in psychotherapy as well as MDMA's role in the elimination of relapses and alcoholism treatment. Now that you understand MDMA's clinical benefits, it is possible to recommend its usage for the treatment of alcoholism. Ecstasy's abuse should not make you disregard the clinical benefits that it possesses. It is all about creating a creative solution to the problem at hand.